If you're scheduled for chemotherapy for mesothelioma, you're probably worried about side effects. Will you be constantly nauseous? Will you lose your hair? Will you be able to function, or will you be bedridden? Today, I want to give you realistic expectations about mesothelioma's chemotherapy side effects. What's common, what's rare, how severe they typically are, and most importantly, how they can be managed so you can get through treatment with the best possible quality of life. I'm Terri Oppenheimer. I've been writing about mesothelioma and asbestos for the website mesothelioma.net for over a decade. I'm not a physician, and this is not medical advice, but understanding and preparing for side effects helps you cope with the treatment. So let's start with the most common mesothelioma chemotherapy regimen. It's pemetrexed plus cisplatin or carboplatin, and what side effects to expect if that's what you're prescribed. Fatigue is nearly universal. Most patients feel more tired than usual during treatment, and the fatigue is typically worse for a few days after each infusion, and then it gradually improves before the next cycle. It's cumulative. You might feel okay after the first cycle, but get progressively more tired with each treatment going forward. And when I say fatigue, I'm not talking about just feeling sleepy. Chemotherapy can create profound exhaustion that makes normal activities feel overwhelming. Just walking to the mailbox might require a nap afterward. This kind of fatigue usually does improve within weeks after finishing treatment, but some patients do experience persistent fatigue that lasts for months. Nausea is what everybody is familiar with, and it is still common, but it's much better controlled now than it was decades ago. Modern anti-nausea medications are very effective. Many patients have mild nausea that's easily managed with medication, and some have more severe symptoms that require multiple medications. Vomiting is a lot less common than nausea. Some patients never vomit, and others might, despite medication. The nausea is typically worse for 2 to 3 days after the infusion, and then it improves. You will receive anti-nausea medications during infusion and prescriptions to take at home. Your doctor will probably tell you to use them proactively rather than waiting until you feel terrible, and they mean it. Now, before I go on, I want to take a break and ask you to do me a favor. If you find these videos helpful, please hit the like and subscribe buttons below. It makes it easier for other people who need this information to find us. Also, if you have questions or there's a topic you'd like to see addressed in a future video, send me a note in the comments section. And make sure you watch until the end, because I'm going to give you valuable information on where to find resources that will make a real difference for you. Moving on. Low blood counts are expected with chemotherapy. Your bone marrow makes blood cells, that's red cells, white cells, and platelets. And chemotherapy affects this production. Low red blood cells cause anemia with fatigue, shortness of breath, and weakness. And low white blood cells also increase infection risk. Low platelets increase the risk of bleeding and bruising. Because of all of these, your blood counts will be monitored before each cycle. And if your counts are too low, your treatment might be delayed until they recover. Some patients end up needing growth factor injections to stimulate blood cell production. Beyond nausea, there are other digestive issues, including loss of appetite, changes in taste where foods taste metallic or bland, diarrhea or constipation, and mouth sores. These vary in severity. Some patients maintain a good appetite throughout their treatment, and others struggle to eat enough. Hair thinning, it can occur with pemetrexed, though complete hair loss is less common than with some other chemotherapy drugs. You might notice more hair in your brush or shower drain, and your hair might become thinner and more brittle. Complete baldness does happen, but it isn't typical with the standard chemotherapy used specifically for mesothelioma. Kidney function is a big concern, especially if you're being treated with cisplatin, which can damage the kidneys. You'll receive IV fluids before and after cisplatin to protect kidney function, and you'll be monitored with blood tests. If kidney problems develop, switching from cisplatin to carboplatin might be necessary, because carboplatin is a lot easier on the kidneys. Another issue that can occur with cisplatin is hearing loss and tinnitus, which is ringing in the ears. This might be temporary and it could be permanent. High-frequency hearing is typically affected first. So if you notice hearing changes, tell your oncologist immediately. Nerve damage, called peripheral neuropathy, causes numbness, tingling, or pain in the hands and feet. This is more common with cisplatin than carboplatin, and it often starts as mild tingling in the fingertips or toes and can progress if chemotherapy continues. Sometimes neuropathy improves after treatment ends, but sometimes it's permanent. Skin rash is common with pemetrexed. This often appears as a red, itchy rash on the face, chest, or back. Taking folic acid and vitamin B12 supplements as prescribed helps prevent this, and the rash is usually mild and manageable, and moisturizers or plain old topical creams can help a lot. Are there side effects that are rare but serious? Yes, severe allergic reactions to chemotherapy drugs can occur, but they're not common. Infusion reactions happen during or shortly after receiving medication. Symptoms include flushing, shortness of breath, chest tightness, or rash. The infusion team will monitor for these. Blood clots are slightly more common in cancer patients receiving chemotherapy. Watch for leg swelling, pain or redness, along with sudden chest pain or shortness of breath. Any of these symptoms require immediate medical attention. Severe infection is possible when white blood counts are low. Fever over 100.4 degrees Fahrenheit during chemotherapy does require immediate evaluation. So don't wait until the morning or your next appointment. Go to the emergency room. Heart problems are rare with mesothelioma chemotherapy regimens, but they can occur, especially if you have pre-existing heart disease. So how can side effects be managed? For fatigue, rest when you need to without feeling guilty. Adjust your expectations of yourself. You will not have your normal energy. So prioritize the activities that matter most. Gentle exercise like short walks can actually help with energy, and getting adequate nutrition helps maintain your strength. For nausea, take the medications that have been prescribed proactively. Eat small, frequent meals rather than large ones, and remember that bland foods often sit better than rich or spicy ones. Ginger tea or ginger candies have been known to help some patients, and whatever you do, make sure you stay hydrated. Dehydration makes nausea worse. If you're experiencing low blood counts, avoid crowds and people who are sick, because low white blood counts make you more vulnerable. Wash your hands frequently and report fevers immediately. If your platelets are low, avoid activities that risk injury, and use soft toothbrushes to keep your gums from bleeding. For appetite and taste changes, experiment to figure out what tastes acceptable. Many patients say that cold foods taste better than hot, and tart flavors like lemon might cut through any metallic tastes you're experiencing. Nutritional supplement drinks have gotten a lot better in the last few years, and they can really help when solid food is just plain unappealing. For mouth sores, maintain good oral hygiene with gentle brushing and rinses. Avoid alcohol-based mouthwashes that sting. Your oncologist can prescribe special rinses if you do develop sores. What should you tell your oncologist? Report any side effects, even if they seem minor. What seems minor to you might be medically significant. Be honest about how you're tolerating the treatment. If side effects are severe enough to seriously impact your quality of life, your oncologist can adjust the dose, change the medication, or provide you with better supportive care. Don't try to be stoic and push through intolerable side effects. The goal is to get you through treatment with the best possible quality of life. and that requires honest and constant communication. To review, mesothelioma chemotherapy side effects commonly include fatigue, nausea, low blood counts, digestive issues, possible hair thinning, and with cisplatin specifically, kidney effects, hearing changes, and nerve damage. Most of these side effects are manageable with modern supportive care medications, and serious complications like severe infections or blood clots are possible but less common. Management includes anti-nausea medications, growth factors for low blood counts, hydration, rest, gentle exercise, and nutritional support. Report all side effects to your medical team right away. You can visit mesothelioma.net for information about managing chemotherapy side effects, or to speak to one of our helpful patient advocates right away. Call 1-800-692-8608 or use the live chat feature on the website. As for me, remember to post your questions below, and I'll see you next time.